Did you know that over 6 million adults in the United States are living with heart failure? And what's even more concerning is that about half of the people who develop heart failure die within 5 years of their diagnosis. It's a staggering statistic, but it highlights a crucial reality we need to talk about, especially when it comes to our beloved seniors. Hello, I'm Dr. Alistair, and welcome to our channel. Today, we're diving into a topic that touches the lives of so many families: the early signs of heart failure in seniors. This isn't just about managing a condition, it's about empowerment. It's about giving you the knowledge to recognize subtle changes that could signal a serious problem, allowing for early intervention that can dramatically improve quality of life and longevity. Often, these early symptoms are dismissed as just a normal part of getting older, but they shouldn't be. Understanding what to look for can be the first and most important step in protecting the heart health of yourself or a loved one. Stick with us, because the information we're about to share could be life-changing. When we think about heart problems, our minds often jump to the dramatic chest-clutching scene of a heart attack. But heart failure is different. It's a more gradual, often insidious condition where the heart muscle doesn't pump blood as well as it should. The challenge, particularly for seniors, is that the early warning signs are frequently misunderstood or ignored. Many people, including seniors themselves and even their families, mistakenly believe that feeling more tired or getting breathless from simple activities is just an inevitable consequence of aging. This is one of the biggest and most dangerous misconceptions we face in clinical practice. The "I'm just getting old" excuse can mask a developing health crisis. Another significant challenge is the overlap of symptoms with other common age-related conditions. For example, shortness of breath could be attributed to a lung issue like COPD, or swelling in the legs might be blamed on varicose veins or kidney problems. This ambiguity can lead to a delayed diagnosis, allowing the heart condition to progress untreated. Seniors also face unique hurdles within the healthcare system. They might be managing multiple chronic illnesses, each with its own set of symptoms and medications, creating a complex clinical picture that can be difficult to untangle. A senior might not think to mention that they started sleeping with an extra pillow to breathe better at night during a routine checkup for their diabetes. This fragmented communication means that crucial clues can be missed. The very nature of aging, with its expected aches, pains, and slowing down, creates the perfect cover for heart failure to quietly advance. It's this silent progression that makes early recognition so critical and yet so challenging. So, let's break down exactly what you should be looking for. The earliest signs of heart failure are often subtle, but when you know what they are, they become much clearer. One of the most common is fatigue. This isn't just feeling a little tired at the end of a long day. This is a profound, persistent exhaustion that doesn't get better with rest. The heart is struggling to pump enough oxygen-rich blood to meet the body's needs, so it diverts blood away from less vital areas, like the muscles in your limbs, and sends it to the brain and other critical organs. The result? A feeling of being completely drained, even after minimal exertion. Simple tasks like making the bed or walking to the mailbox can suddenly feel like running a marathon. Another key sign is shortness of breath, what we call dyspnea. Initially, this might only happen during physical activity, like climbing a flight of stairs. You might notice that you're getting winded more easily than you used to. But as heart failure progresses, this breathlessness can occur even while you're at rest. A particularly telling sign is something called orthopnea, which is shortness of breath when lying flat. People often find they need to prop themselves up on 2 or 3 pillows at night just to breathe comfortably. This happens because when you lie down, fluid that has accumulated in other parts of your body, like your legs, can move back into your chest and lungs, making it harder to breathe. If you or a loved one has started building a pillow fortress to sleep, that is a major red flag. The third hallmark sign is fluid retention, or edema. When the heart isn't pumping effectively, blood can back up in the veins, and the kidneys may respond by retaining more water and salt. This excess fluid has to go somewhere. It often collects in the legs, ankles, and feet, causing noticeable swelling. A simple way to check for this is to press a finger gently on the swollen area for a few seconds. If an indentation, or a pit, remains after you remove your finger, it's a classic sign of pitting edema. This fluid can also accumulate in the abdomen, causing bloating and a feeling of fullness, or even led to rapid weight gain over just a few days. If the scale suddenly jumps up by 2 or 3 pounds in a 24-hour period, it's not fat. It's almost certainly fluid, and it's a sign that the heart is struggling. Other, less obvious signs can include a persistent cough or wheezing, especially when lying down, which is caused by fluid in the lungs, a loss of appetite, or even confusion and impaired thinking due to changing levels of substances like sodium in the blood. Recognizing these signs for what they are, not just old age, is the first step toward getting the help that is so desperately needed. I want to share a story that truly underscores the importance of everything we've just discussed. I had a patient, a wonderful 78-year-old gentleman named Robert. He came to see me at his daughter's insistence. Robert was a proud, independent man who had been active his whole life. But for the past 6 months, his daughter, Sarah, had noticed changes. He was always tired. He'd stopped his morning walks, complaining that he just didn't have the energy. He'd also developed a dry, hacking cough that got worse at night. When Sarah would visit, she noticed his shoes seemed tighter and his ankles were puffy. Robert dismissed it all. "I'm nearly 80, Sarah," he'd say. "What do you expect? I'm just slowing down." He blamed his cough on allergies and his fatigue on poor sleep. Sarah, however, had a gut feeling that something more was wrong. She remembered her father used to be able to work in his garden for hours, but now he was out of breath just walking to the end of the driveway. During the appointment, Robert was reluctant, almost embarrassed to be there for what he considered minor complaints. But as he described his symptoms, the puzzle pieces started to fit together. The fatigue, the shortness of breath, the swollen ankles, the nighttime cough. It was a textbook presentation of early heart failure. We did an echocardiogram, an ultrasound of his heart, which confirmed our suspicion. His heart's pumping function was significantly reduced. The diagnosis was a shock to Robert, but it was also a turning point. We started him on a regimen of medications designed to help his heart pump more efficiently, reduce the fluid buildup, and lower his blood pressure. We also connected him with a cardiac rehabilitation program. The change was remarkable. Within a few months, the cough was gone. The swelling in his ankles disappeared. Most importantly, his energy returned. He started his morning walks again, and soon he was back in his garden. Sarah told me, with tears in her eyes, that she felt like she had her dad back. Robert's story is a powerful testament to the impact of early detection. Had Sarah not trusted her instincts and pushed him to get checked, his condition would have continued to worsen, likely leading to hospitalization and a much poorer quality of life. His case is a perfect illustration of how paying attention to those small changes can make all the difference in the world. So, let's quickly recap what we've learned today, because this is information that can truly save lives. The early signs of heart failure are often mistaken for normal aging, but they demand your attention. Remember to watch for persistent, unexplained fatigue that doesn't improve with rest. Pay close attention to shortness of breath, especially if it happens during minimal activity, at rest, or when lying flat at night. And don't ignore fluid retention, which can manifest as swollen legs, ankles, and feet, or sudden weight gain. Recognizing these key signs early on is not about being an alarmist, it's about being proactive. Early diagnosis and treatment can halt the progression of heart failure, alleviate symptoms, prevent hospitalizations, and significantly improve the quality and length of life for our seniors. Now, I'd love to hear from you. Have you or a loved one experienced any of these symptoms? What was the outcome? Sharing your story can help so many others in our community, so please leave a comment below. And if you found this video helpful, be sure to like, share, and subscribe to this channel for more content. Thank you for watching, and be well.